So when somebody comes in with a foot problem, the first thing we want to do is find out what the history of that foot problem is. So you're going to get asked a bunch of questions about how long you've had the problem, where it hurts you the most, and if there are any concerns you have about the foot, plus anything you've already done to take care of your foot problem and whether or not it has helped you. So then what we're going to do is we're actually going to look at the foot, because the foot's going to tell us a lot of things about the body that you may or may not be aware of. So you may have areas of pain in your foot, and then you may have areas that don't hurt until we actually stress them and poke at them. So when we look at the foot, we're not trying to cause you pain, we're trying to identify areas where there is pain or where there is a problem. And so what we're going to do is we're going to look for areas of swelling, any areas where there's any bunions, any corns, any callus formation, anything like that, because that's going to tell us whether or not your feet are actually supporting the body. And so your body is trying to do what makes sense for it, and so we're just trying to see what the body is telling us about how you're using your feet. And so then the next thing we're going to look at is whether or not the foot is moving. So you can see here this arch is moving. We can get in here and feel each and every one of these little bones and see if they are moving independently or if they are moving only as a group. And then we'll give the ankle just a little bit of a check there also, make sure it's all working properly. So anywhere that we have an area that's not moving very well, or anywhere that your body has decided to put down additional callus material, that will let us know that that's an area that we need to look at. In our office, we help a lot of people with foot pain. And one of the common things that we see with feet is plantar fasciitis. And plantar fasciitis occurs when the foot is no longer moving the way it's supposed to, and so especially for people who are standing a lot, standing all day, or just on their feet walking around all day, what will happen is all of the calcium and other things that are moving throughout your body will tend to accumulate in your feet, because that's how gravity works. And so if you don't give yourself enough time to relax at the end of the day, and you don't get all of this massaged out, what will happen is that'll accumulate, and over time, instead of just being a little bit of extra calcium in your feet, it'll actually pack down kind of like sand in the bottom of your shoe, except this is your foot, not your shoe, and you can't just take it off and go buy a new one. So one of the things that we do in our office is we have a therapy called shockwave, which breaks up all that sand and helps it move out of the body, and it is relatively painless. So I'm going to show that to you now. So what we're going to do first is we're going to take some gel, and we're going to put it on the area that we're going to treat. And the worst part about all of this is that gel is a little bit cold, but the rest of this is relatively non-painful. So then we're going to take this and put this on the area that we're going to treat, and it will get a little bit noisy, but other than that, there should be relatively no pain, and we'll get this all cleared out. Another therapy that we have in the office is a medical grade laser. And what the laser will do is it will stimulate your stem cells to be active. It'll clear out inflammation. It'll help break up adhesions and other things that are going on in the muscles of the foot. A lot of times, especially with heel pain, we find that there are a lot of tight muscles in the calves that are actually pulling on that heel. And unless and until we can get these muscles taken care of, that heel pain is not going to go away. So we want to make sure that we're addressing all the issues with the foot, and the foot includes the ankle and this whole group of muscles here. So the way that the laser works is there's no pain. Occasionally it'll get warm, but other than that, it shouldn't hurt.